Welcome to Unit 5, WHO Milestones on Air Quality and Health. By the end of this unit, you will recognize what the purpose of the WHO Global Air Quality Guidelines is and list WHO milestones on air quality and health. WHO has been following the growth of evidence of the impact on air quality and health since 1958, evaluating and summarizing knowledge on the health effects of air pollution. In 1987, WHO formulated the first evidence-based health guidelines for more than 30 pollutants, based on a global synthesis of scientific evidence. In the 2005 global update of WHO air quality guidelines, focus was made on the rapidly growing evidence of the health effects of classical air pollutants. These include particulate matter, ozone, nitrogen dioxide, and sulfur dioxide. The term classical is used to indicate the most health-damaging air pollutants. The guidelines recommended which air quality levels should be achieved in order to reduce the adverse health effects of air pollution. Since the 2005 global update, there has been a marked increase in the quality and quantity of evidence that shows how air pollution affects different aspects of health. The 2021 WHO Air Quality Guidelines include clearer insights into the sources of emissions and the contribution of air pollutants to the global burden of disease. After a systematic review of the accumulated evidence, several of the updated air quality guidelines levels are now lower than the previous version of the guidelines. For example, the recommended value for annual concentrations of PM2.5 is 5 micrograms per cubic meter, whereas in the previous guidelines the threshold level was 10 micrograms per cubic meter. While exceedance of these levels is associated with important risk to public health, it is important to remember that risks exist below this value and that there is no threshold with no health effects. New features also include new air quality guidelines levels for peak season ozone and 24-hour nitrogen dioxide and carbon monoxide, as well as new interim targets. Interim targets are air pollutant levels that are higher than the recommended air quality guideline level, but which authorities in high polluted areas can use to develop pollution reduction policies which are achievable within a realistic time frame. You have now completed Unit 5. Please download the reading material for further information. Now try the end of module quiz.